is alerting healthcare professionals about rare but serious complications associated with the surgical mesh used to treat pelvic organ prolapse and stress urinary incontinence. The mesh is usually placed transvaginally using minimally invasive techniques.
Over the past 3 years, FDA has received over 1,000 reports of complications. The most frequent included erosion of the mesh through the vaginal epithelium, infection, pain, urinary problems, and recurrence of the prolapse or the incontinence, and their effect on quality of life, including scarring and pain during sexual intercourse. Patients should also be informed that implantation of surgical mesh is permanent and that some complications associated with the mesh may require additional surgery that may or may not correct the problem.
Millions of women in the United States suffer from pelvic organ prolapse, which occurs when the pelvic organs, such as the bladder and urethra, drop downward, often due to a weakness in the vaginal wall, which can be associated with childbirth, hysterectomy, or menopause. When this occurs, it can create pressure on the vagina, pushing it, causing discomfort, and even incontinence. Commonly what is known as stress urinary incontinence, a loss of urine that occurs during physical activity, such as coughing, sneezing, laughing, or exercise. Typically, the procedure used for repairing a pelvic organ prolapse is called an anterior colporrhaphy, where weaknesses in connective tissue or fascia are stitched together. A newer surgery, the transvaginal mesh procedure, involves using a piece of synthetic mesh, which is generally made of polyester or polypropylene. The mesh has what looks like wings called trocar, which are used to anchor it into the connective tissue, where it is sutured into place. In 2010, in the U.S., approximately 75,000 surgeries using transvaginal mesh procedures were performed, which represented 40% of all transvaginal procedures. In an FDA study analyzing organ prolapse patients from 1996 to 2010, it found that those women who received transvaginal mesh to treat this condition were exposed to additional risk compared with those women who were treated with traditional suturing. Both types of procedures, suturing and the use of mesh, according to the FDA, produced similar results. Adverse health effects from the use of transvaginal mesh have been discovered, such as erosion of the mesh through the vaginal tissue, pain, infection, bleeding, pain during intercourse, organ perforation from surgical tools used in the placement procedure, and urinary problems. Medical options for treating the symptoms of failed transvaginal mesh are limited, but include surgery. However, as outlined in the FDA's warning, surgical mesh is a permanent implant that may make future surgical repair more challenging. A mesh procedure may put the patient at risk for requiring additional surgery or for the development of new complications. Removal of mesh due to mesh complications may involve multiple surgeries and significantly impair the patient's quality of life. Complete removal of mesh may not be possible and may not result in complete resolution of complications, including pain. Additional treatments for mesh failure include IV therapy, blood transfusions, and drainage of hematomas or abscesses.
I'm Andrew Sello with Sello & Sello Attorneys, and we're pharmaceutical litigation attorneys. In the past, Howard Nations and I and the Nations Law Firm have litigated several different pharmaceutical litigations. Currently, Mr. Nations and I are litigating transvaginal mesh litigation.
Thank you, Andrew. If you have a problem with a transvaginal mesh, or if you're having the symptoms that are indicated in this video that lead you to believe that you may have a problem with transvaginal mesh, then call us and we'll see to acquiring your medical records and the necessary testing to see if in fact that is a source of your problem. My firm, along with Mr. Sello, we're prosecuting hundreds of vaginal mesh cases at the moment. There are thousands of these cases on file in the country. So it's very possible that the problems you're having may be resulting from the transvaginal mesh. So call us. We'll be glad to work with you in identifying the problem and prosecuting your case if in fact you have one.